So then we found Sharif at last. I'm going to start this discussion a little bit at three angles. One is how can employers play a role in the management of cancer. Dr. Nirmala has done a lot of research around financial toxicity. I remember some years ago she came up with a paper that found that within 1 year of Malaysians being diagnosed with cancer, they were already financially challenged. So that is a big problem. And Sharif is actually going to help us understand a little bit more about how pharma companies can come in and make sort of novel treatment more accessible to the public. I think there is a disparity. We heard from our earlier session, those in urban and rural areas, there is a divide. There's also a divide when it comes to those who can afford and those who cannot afford certain types of treatment. So we'll go and look at that access and equity aspect of things. But I'm going to start with Nirmala about what the last panel left off with, which is the psychosocial aspect of cancer. A lot of us don't talk about that, but Nirmala, you've done a lot of work along those lines. You just want to shed more light on the importance of that in the cancer journey.
Thanks, Meera. A very good afternoon. I think a lot has been happening in cancer. Also from the provider's perspective, as in the healthcare professional, government, but also in the patient space. And many of the developments and what we have been seeing in the past half century is all towards new medication, access to better treatment, and people living longer. And this is fantastic. But what has been missing is the discussion on how are we helping patients living better. So living longer does not mean living better. I think a lot of you will agree, right? And we feel that we could do much more to help people live better. And when we talk about live better, meaning that we are delivering patient-centered care. And patient-centered care means that we are not just worried about the cancer or the organ where the cancer is, but how the person is living life as a whole person. And that means we have to take into account the psychological well-being, how people feel emotionally. It's also important because it relates back to taking the medication and staying within the treatment that has been prescribed for a person. But we're also talking about surviving financially. So the financial survival is not just about paying for treatment, but needing to work to put food on the table. So that's where we feel that there's a major gap. And in the past 2 decades, a lot has been done in the high-income countries to fill that gap, to help patients live better, not live longer. And the low and middle-income countries are only following.
That is excellent. How do patients live better rather than longer? I think a lot of you here may be able to share something or you have a question. I'm going to open up the floor now. If you want to ask questions, just walk up to the mic and we'll be happy to answer some of those questions. Meg, as an employer, pretty much manufacturing companies that you represent, what happens when an employee is diagnosed with cancer? How do employers cope with that?
Okay, from the employer perspective, of course, we do provide medical insurance, and during COVID days, a lot of good and bad happened. Many companies closed, many companies are still surviving, and from there we learned how to work from home, flexi hours, and we use that to apply to our staff who are actually diagnosed with cancer. And sometimes the employees are a bit reluctant to divulge, So we have a very good, we have a very good rapport with our employees here, for sure, because our company culture is such that our employees are our family, so they don't have a free hand to approach the management when they have an issue, and especially when we're talking about cancer. It's a stigma, it knows no boundaries. And not only for the employees, for the families as well. Now, young children also are diagnosed with cancer. in our company, probably there are one or two, kids, parents who are working with us. So we do provide oral support that they require, and also when it comes to working hours, we allow them the flexibility to go for treatment, take care of the families.
Would you say that's just your organization, or would you be able to say that for the Federation of Malaysian Manufacturers, for an example?
It's more for my organization, I'm sharing, but I believe the member companies do also have such good things in place, because
how do we provide that comfort that, you know what, you can come forward and tell us that you have been diagnosed with cancer and that you will not lose your job. I think that is such a big thing. It is a real thing.
Yes, the job security is very important, yeah. So, of course, when they come to us, we are very empathetic. I mean, speaking from my company's perspective, I can't be speaking on from the federation as a whole. I think, to be fair, I share what my company, does when it comes to our employees being diagnosed. So we are very empathetic towards this. We do, have a lot of engagement, and then we also talk to the staff. We give them whatever assistance. Just reach out to us because we are very employed. Yeah.
Okay. Once again, if anybody wants to share your journey, please come up to the mic. Sharif, first of all, thank you very much, MSB, for sponsoring the 300,000 doses for the Leave No One Behind campaign, and I think they ought to be given a huge round of applause for actually backing this. It's been wonderful, and this is for girls in underserved communities who usually will not have access to the vaccine because they don't fall under the school's program. But, pharma companies, I think, Sharif, not really in the best books of most people, right? You're known for very expensive drugs which are not accessible to the masses. How will MSB sort of address this inequity? As Professor Su said just now, faster, cheaper, better. It's probably not the best thing in MSB, but how do you meet us halfway to make it more accessible?
So thank you. Firstly, thank you very much for the question and for the opportunity to be involved in this conversation. As a company, so I speak from the perspective of a company, and I think this resonates also for the broader industry. We have two primary drivers that focuses our mind. Number one, how do we enable the discovery of the best possible therapeutic solutions for the diseases that afflict humanity? So we're at the forefront of doing that. But the second thing that's also top of our mind is a recognition that whatever we discover that does not end up getting into the hands of the people that need it doesn't actually make a difference. So from our perspective, those two things are things we've never separated. They've always been side by side. And as if you go back and look at the history of how we have operated as a company, you will see that. For example, we were the company that discovered one of the most effective ways of solving river blindness. What did we do? When we could not figure out a way to be able to make that available commercially, we as a company committed to donate every dose until the disease is eradicated, and we've done that consistently for 30 years. So I think that is the legacy of who we are as a company. And I think it's something that we as a whole broader industry also relate to. Now, it's one thing to do that for a few disease areas. It's another thing to operate consistently doing that while still having enough to invest in discovering new diseases. So our focus is on how do we enable sustainable, equitable access. So here's how we do it. From our perspective, what we try to do is, number one, make sure that we are listening to the clinical needs of Malaysians. My job is not to bring what has no benefit to Malaysians to Malaysia. No. My job is to work alongside the Minister of Health to understand what are the health needs of Malaysians and how do we make sure that what we're discovering is exactly what Malaysians need today, but also for generations to come. So we protect everybody today, but we also protect our children from what might harm them in years to come. That's how we start. Secondly, we work in partnership. So yes, we're a scientific company, but there's so many things we don't know. There's so many things we don't do. We don't do anything about, educating people on diseases. We try our best, but that's not what we're very good at. There's a lot of things we don't do around. We don't deliver care as a hospital. We're not a financing company. So there's so many things we don't know. But what we know, and this is why this event is so helpful, is that everybody plays a role. So we focus a lot on partnerships. We sit down with the government and we try to partner with the government to make available what we have within what the government can afford. So it gets to everybody. We work with insurance companies to help them understand how our medicines are coming so they can include it within insurance plans and it becomes more affordable. We work with employers to help employers understand the benefit of preventative health, because the best possible scenario is that nobody ever even needs our medicine. That is my hope in life, that actually we get to a position that nobody ever needs the cancer medicines that we make. But for those who need it, we want them to get it exactly when they need it and in an affordable way. So we try to work with employers to make sure that preventative work is done, screening is done, vaccinations are done, so we can prevent the disease from happening. So that's how we try to look at equitable access, by thinking about the whole ecosystem that needs to be in place and making sure that we are there to help build that ecosystem. But I absolutely assure you, there is nobody that is more worried about the fact that there are cancer patients that may not be able to get our medicines than me. And what we also do as part of that is we have patient programs. So we know that there are people who struggle, and we have programs in place, some of which we do in collaboration with the National Cancer Society, to make our medicines available freely to populations that cannot reach them. And once we do that, there are other companies that do the same sort of thing as well. So I think as an industry, we try to respond. Well, my big message to you is it takes a village. So that's where we also need you to help us understand what more can we do to help make it even more effective.
Fantastic, Joe. I'm so impressed. Thank you. At least it gives it an idea of what else you actually do to help support the ecosystem. Meg, are you working with Sharif yet?
Looking forward.
Okay, there you go.
Because this is a fantastic forum and a good event. Actually, I met a few cancer survivors, and very glad that to hear that they have survived 15, 20 years and more. So, as an organization and a caring company, we are really looking forward to work with you. Right?
Fantastic. We spoke about the financial challenges, and you said as an employer, you have group insurance and you're trying to cover. Obviously, that's very little if you look at the entire cancer journey. What are innovative models, Nirmala, when it comes to funding and financing this journey? How much does it cost on average? Is it 400,000 million for one person in the Ministry of Health setting?
It depends on the cancer at the stage. Yeah.
Okay. What are innovative solutions? Do we have any?
Okay, I'm going to take a step back, because when we get together in a common forum talking about cancer, a lot of us tend to talk about how governments need to step in, there needs to be a cancer drug fund, there needs to be a reshuffling of the way we finance health, and these have been talked upon for the past, I think, 20 years. Ever since even I came back from my training, they've been talking about different ways of how health can be financed in Malaysia. So I think all that is very good. We need to go on with the conversation and trying to get system-level solutions to come out. So getting better funding, more funding for cancer is all systems-level solution. But I think for innovation, we need to think what is practical and what can be done at the patient level, community level. And one of the innovative ways where I think access could be improved, not only access to drugs, but also living better, I think is one of it is financial navigation. So we heard about patient navigation being spoken about earlier, about how we have navigators who help connect people who have problems, whether they know it's cancer or no cancer, connecting them to timely diagnosis, getting access to treatment. Financial navigation is not new, it's just an extension of patient navigation. So we have navigators who are trained to help patients connect to resources. And resources not necessarily mean money. It doesn't mean that we are just getting charity assistance, but it also means that we are connecting people from any level of income to resources that can help them get access, live better. An example is a middle-class person who might need debt management advice. So financial navigation can be very wide. It can be from connecting people to get charity assistance to applying for existing funds like so. The paperwork is tremendous. If that is a guide or a navigator, it'll be better. And the scope of services within financial navigation can be massive, like in the US, but we can also start small. So this is a way that we can set up a patient-level solution that can be acted upon by not only health system, but also players like pharma, insurance, social welfare organizations, NGOs, and so on.
Okay, we'll come back to who is that leader of all of this, or who brings the ecosystem together. Well, we have a question from Asro.
Thanks, Meera. If I could ask the panel, we talk about it being everyone's business, and the word investment comes up quite a bit, and we speak about health not being expenditure, it's investment. But we know, like the government and even businesses, they look at it differently. They see, when it comes to cancer, it's a black hole. It's where money goes and we don't see a return. That's the thinking. How do we go about changing people's ideas of looking at investing in people who are not well, with the idea of making them well again, but also being seen as an asset and investment? How do we change that mindset from expenditure to investment when it comes to cancer? Thank you.
I can take that because it's easiest to start first, right? And that sharing things that I didn't say earlier. I love that idea of investment because for a long time we have been selling cancer as an expensive thing that governments, everyone shy away from talking about funding. But I think what we need to do, and we are not doing well, is making the economic case for investment by looking at the indirect cost. Because we're always talking about the direct cost of cancer and talking about how expensive drugs are, treatment are. But the indirect cost comes from the fact that a lot of our patients are young, they have been working, contributing to the economy, and when they don't work, how much do we lose? That's the cost of inaction. And if we can stress upon that when cancers are detected early or treated well, people go back to the workforce. And that is very beneficial to the employers, to the society at large. We get all that we lost by investing earlier and making sure that all these people come back to the workforce. And it doesn't mean that those who do not work are not no value, because we have mothers, we have caregivers who can give better care to their family, and it all works out. So we are not making the case for the cost of inaction, especially when we talk about the indirect cost of cancer. So I think we need to do that better. We need research at local level. We cannot be quoting values from other countries. I think that could be one of the game changers.
Okay, so we need to put a business case forward.
I think this is something that is very, very dear to my heart, actually. Not just from the perspective of society, but also from the perspective of humanity, right? And think about it. A mother developing breast cancer and passing away, if she has left behind 3 children, that has transformed the lived reality of those 3 children in ways that we can't even begin to comprehend. There is a loved one, there are parents, there are cousins, there are so many dependents. For all we know, that mother also used to volunteer in a local community group. So that whole local community group has lost an anchor that was the fabric of that society. So even beyond it's easy to say go back to work, productivity, because there's a one-to-one correlation between work and results. But actually, how do you really make sure that that societal value of a life is really, really seen for what it is, beyond just somebody that can do a 9-to-5 job? So, and for me, charity begins at home. So I took that view even for us as an employer. So forget about the fact that we make and we're involved in cancer. As an employer, we MSD have about 400 employees here in Malaysia. So the question I ask myself is, are we living that reality in ensuring that we're practicing what we preach? So we make it our business to make sure that all of our employees truly understand exactly why staying well is critical. For me, if I'm intervening at the point where they are ill, I've even left it too late, because that has introduced stresses that I can't even comprehend. So I want them to know that staying well is important. I also want to make sure that our benefits that we provide to our employees allows them to stay well, and allows them to continue to have productive lives as they stay well. Inevitably, we go through ups and downs. Some might then end up not feeling well, and that's okay. We look after them at that stage as well. Recently, we've gone even further. We've introduced enhanced benefits that mean our employees can take coverage for their parents. Because what we also know is, thankfully, we're living longer. So our employees have parents that are alive, some of them are retired, who may not always have the scale of coverage that they need at their point of retirement. So in my view, it's our business to care about the mental well-being of our employees as well, so that they feel protected, they know that their children are protected, and they have the means to protect the people they care deeply about, their parents. Now, I think what we need to do a lot more of is telling that story. So it doesn't degrade itself down to an economic story of the quality is 10,000. What does that mean? Right? How do you quantify the fact that the kids in that neighborhood are not likely to go to jail because that mother is alive and she has created social programs in that community that has kept crime down? How do we quantify that? Right? So I just think that we need to do a bolder job in talking about the real value of looking after each other, full stop. Physical health and mental health, and the real value of investing in it. Because for every investment we make in wellness and keeping people well, discovering new things that help to protect people for the long term, we completely transform society. And any notion that we will create a world-class society in 2050 goes out the window if we don't prioritize what we do for health. And it's not just the government's business, it's all of us who play a very important role in that.
And that's what you champion, value-based solutions.
Absolutely. So when we talk about value-based healthcare, I hear that a lot. Unfortunately, we reduce that to what is the value of a particular pill, or what's the value of a particular intervention. And in some respects, we almost miss the notion of where this whole conversation started off from. The notion of value-based care, in my humble opinion, is centered on the view that let us think more holistically and systematically to invest in the things that create the greatest longer-term value, versus coming when it's too late to cope with the consequence of not having invested in the things that created the longer-term value. So I go back to cancer prevention, right? So some of us are involved in the therapeutics of things like cervical cancer, but it breaks my heart that we're talking about how do we treat people getting cervical cancer in this day and age. The whole conversation should be people should not get cervical cancer. That's the best way to do it, right? So for me, the whole notion of value-based care is how do we prioritize the right things for the right people in the right time so we achieve broader societal value, versus how do we look specifically as microcosms of intervention.
We'll come back to that, because prevention, cancer, I also know cancer doesn't choose. A lot of it has to do with that. So what's that conversation? What does that conversation look like? Well, we have a question.
Thank you so much for this opportunity. My name is Associate Professor Dr. Abdullahi. I'm from Universiti and currently a practicing clinical hematologist. fetal hematoma to be exact. So hematological cancer has been by far has been known to be a very established cancer with targeted therapy, as all of you have learned about chronic myeloid leukemia. So I'm looking at this esteemed panelists because it has been almost 50 years that we've gone through experiences with targeted therapy. Now, number one for the pharmaceutical company. Realistically, not all of us are rich. You are low to middle income country. You're not talking to the United Americans or British. You're talking to a mixed cultural, and walks of life. And definitely I have this problem in trying to get awareness funding for those who are P40s. In fact, I'm very sad to say that we ourselves are in a caste community where you have T20s and B40s, and I couldn't get to reach B40s even in University Hospital. So when they go to the Ministry of Health Hospital, relentlessly the fundings are also problematic. So I was wondering, pharmaceutical company, when will be the best time for you to release your patent? So that you make it cheaper, and so that other companies can make a generic form out of it. And that is really an investment outright, number one. Number two, for our financial experts in cancer treatment, could it be not anymore on cost effectiveness? Could it be not anymore cost benefit analysis, which is very tricky to look at one cancer patient of all sorts and how much benefit can we actually gain from treating one cancer patient? Because I'm dealing with their depression, I'm dealing with their financial toxicity, and there are not many oncologists or hemato-oncologists to deal with all the psychological depression. In fact, we hematologists and oncologists are also brain drained looking into all the aspects, besides looking into their remissions. And it is depressing for all of us to really need to sort all these around them. So I was hoping from now on, this 2024 already, we have been discussing this from years end, from the last 20 years that you mentioned, we need to change. That's all. I hope to have some outputs from the esteemed panel.
Sure.
Thank you so much.
Thank you very much. Sharif, I want to you first and then second.
Thanks for the comment. I think it relates back to what Azrul asked. We need to change and think of everything that we do from now onwards, whether putting money or putting effort or getting together as an investment. So I think the word has to change and no more talking about cost but talking about investment. And like I said earlier, I think we need to think of pragmatic solutions while waiting for health systems to rebuild themselves, recalibrate themselves. We can call it in whatever way that we want it. There needs to be local level solutions. And the solutions need not only come from health systems. I think that is the key point. We cannot be only relying on health systems. It doesn't mean that we are letting them off the hook. They have the role. They need to lead. The health system need to lead. But we need to think about how the community can come together, the industry partners, and when I talk about communities, it also means NGOs, professional societies, how we can leverage together to mobilize resources from one sector to another. So I think that is the way forward, and we must start thinking about working together. And I just have one message I think I would like to say now, because there are a lot of patients and patient support members here. Apart from what Prof. Teo said about painting a more positive picture, I think the other thing is when we go to people with certain power, not necessarily government, don't go only with problems. We have heard problems for a long time. Go with solutions. The solution may sound very simple, very individualistic, but I think all these solutions are good for us to put together and think of programs. So go with solutions. I think all of you have solutions. It's just that we are too shy to talk about it. So come with solutions. Whatever that comes to your mind, we can brainstorm together.
Could you give us a quick example, Nirmala, of a solution?
Solution. I can give one. So the idea about financial navigation that we were talking about, it's not my idea. So we had some time ago wanted to look at what patients need, people with cancer need. We thought that the way our health system is functioning it's very biomedical. We are talking about treatment, preventing recurrence, monitoring for recurrence, and so on. So we wanted to know, there are a lot of reasons why people don't stay within treatment. They are unhappy, poor quality of life. So we got a lot of patients together, started talking to them, and we wanted to know what they need. So we developed some tools from our interviews patients. But what we gathered is in terms of financial needs, a lot of them say there are a lot of, for instance, just giving one example. We have SOXO, we have, like the paperwork is tremendous. We need someone to help us with the paperwork. Or they say there are some resources, but I don't know how to get in touch with the resources. So we need someone to show us the way. So that's how we realized, okay, that's a solution. It's a financial navigation, we need to formalize it. So that's the kind of example that I'm talking about. They have ideas, they just need to talk about those ideas instead of just talking about the problems.
Okay, sure.
So I think you raised a very, very important question, right? Around novel therapies have been around and new ones continue to emerge. If I may, it might be that we have a slight difference in what we diagnose the issue to be. So let me park the IP issue to one side because I'm not sure they're the same thing. The reality is, even companies like us provide huge mechanisms through which patients in different socioeconomic groups can access our therapies. What we're learning a lot of is a lot of patients don't actually know. So they don't benefit from it sometimes until it's too late. And also we accept that we can do better in communicating and engaging so that people understand these things a lot better. Hence our collaboration with parties like the National Cancer Society. But just as an example, we had the same conversation about a lot of people are outside of the national programs of cervical cancer elimination. They were not likely to benefit from the national programs, and they're not getting it through what's available alternatively. So what did we do? We partnered with CSL to do the biggest thing that we've ever done in enabling to make sure that no person is left behind. So I think the two things are separate in that, yes, there are actually already a range of things companies are doing to enable people in different socioeconomic groups to access targeted therapy. And we can do more to communicate that so people know. I accept that 100%. And it's something that we want to work on, and I'd love to follow up with you afterwards to see what more can we do to help to make sure that that is understood. But equally, beyond that, what more can we do to ensure that no person is left behind? But I don't think that that is necessarily linked to the IP conversation, because the challenge with, the notion of intellectual property is an important one in being able to provide the right safeguards to ensure that people can continue to innovate. And in itself, it hasn't been a barrier for people like us to make our medicines available. Obviously, I can't speak for other companies, but I gave you the example of what we did for river blindness. Yes, we have the IP, but it has to be, with that, we have made our medicines available to an extent that there are countries where river blindness is more or less eradicated. And we're incredibly proud of that. So those two things aren't necessarily connected. But I guess my message to you overall is, I think, yes, there is more that companies like us can do to communicate the things that we already have available that patients are not taking advantage of necessarily for the reasons of navigation. Maybe it's too complicated, maybe people just don't see it, maybe they get lost in the system. There's a lot more we need to do to improve on that. And then in partnership, there is more we can do to expand on these programs to go even further. And if you needed any evidence that we're serious about that, you've seen that through the No Person Left Behind. We are very serious about that. So I hope that gives you some reassurance about the question, specifically. Just to make sure that, I want to make sure I get the answer that we are committed to making sure that every single person that can benefit, certainly from the innovations that we make, has the ability to do so. That is our commitment. And we're committed to working alongside partners to figure out how to do that in a sustainable way. And we are committed to making sure that when we do that, we protect the patients of today, whilst also doing everything we can to protect the patients for the next 100 years.
I think we need to go back and relook as well as behavior change and how is that going to drive people to come forward and screening. I mean, you can provide all these services and people don't take it up. There's absolutely no point. So I think a lot of communication has to be done. Engaging with communities, helping them understand is also crucial to this entire journey. Meg, any sort of solutions that you feel employers can better work on to support employees in the workplace?
So, like what Dr. Nirmala mentioned, don't come with problems, when we see our bosses. Come with a problem and a solution. It may be a good one, it may be, it's just come with solutions, right? And of course, I hear from the floor just now that the doctor did on the affordability of cancer treatment. Actually, cancer is expensive treatment, right? I mean, the government should also look at public, the general public, because not everyone can afford private treatment. Okay, the accessibility of information, what they can offer, engagement is very important. You have to communicate with NCSM and so many other, NGOs out there. And I feel it is more to do with engagement and the awareness, more outreach programs, so that industries also know, yes, if, our staff are affected, how do we navigate that? To give, instead of them being stigmatized when they are diagnosed, we make them feel that company is also looking at solutions for them, and we need to engage more with all those where to reach out for assistance. Yeah, I think that's very important. Yeah.
Would you have a message for us, Nirmala?
Message?
I always have to. Everybody had to give a message.
I think I gave my message. I think for patients, from the perspective of patients, I think we need to think of solutions together. And a word that I want all of you to remember is co-creation. So when we are coming up with solutions from our end, from the governments, from the policymakers, we push for co-creation, meaning that you want to be involved in part of that solution making. And I think that is something that I would like to encourage all of you to advocate for, to allow you room and voice to be part of that solution making. Because for a long time, the way that health system has been working is very paternalistic. We think we know what we want and we build the solution. So that's why I think to build solutions, we need co-creation, and patient support group members are important. So push for co-creation, push for your voice to be heard in a formal manner. In a formal manner, meaning that when we are having this platform available, come forward and say, I want to be included. I think that will be one of the messages that I would like to send to everyone.
Sharif?
I think my main message is building on that theme is the industry is committed to helping to make it possible. That's my message. So there is always this notion that the industry is the barrier. No, the industry wants to be part of the solution. I am here, I'm not going anywhere after this. So charity begins at home. I put my hand up. If you feel there is more we can do, come and see me, we will do it. But the main thing is that co-creation, and the industry is absolutely brilliant. And have that in your mindset overall. I think that's my key message.
Thank you all very much. Thank you, Meg. Thank you, Dr. Nirmala and Dr. Sharif. Thank you all very much for your questions.